important topic that really covers everybody here in the United States. It's 1 in every 18 Americans has colon cancer or is affected by it. And today joining with me is Dr. Jan Prazak. And now, Doctor, you're going to be talking to us today about colon cancer awareness. Now, why is it so important to be proactive about colon cancer?
Well, David, March is Colorectal Cancer Awareness Month, so we're really trying to get the message out there for people to get screened. Colon cancer is the third most prevalent cancer, the highest in mortality after lung and breast in women and lung and prostate in men.
Wow.
But it's one of the more preventable cancers. So people should start thinking about getting a colonoscopy, which is a simple test with a camera to check their entire colon or large intestine to find colon polyps. Colon polyps are little tiny clumps of cells that can grow slowly, and some of them can turn into cancer. So we're trying to catch these little polyps early, and that way we prevent cancer from forming.
And that's one of the symptoms that you're looking for. So that's, and of course there's a lot of other symptoms, but talk to me a little bit about that. What are some of the other symptoms?
Well, polyps don't usually give any symptoms, but if people who have symptoms of colorectal cancer may include a change in your bowel habit. If you notice a change in your usual bowel habits, that may be a reason to see your doctor. Many people do not experience any symptoms whatsoever, so that's why it's important to get your test done at a timely fashion at age 50 for most people, but some people may need to start sooner. Patients who have a family history of colon cancer, for instance, should start earlier. Patients from our African American descent, there is data to show that they have a higher risk of colon cancer, so they should start at age 45.
And speaking of risks, what are some of the risk factors of colon cancer?
Basically, diabetes, obesity, smoking, alcohol, having a family history of colon cancer, a diet that is low in fiber, high in fat, can lead to formation of colon cancer.
So really, we got to watch what you eat, right?
Absolutely.
That can help perpetuate any of the symptoms that you already have. Now, how is it diagnosed? Like, what is Baptist Health Systems doing to help and diagnose colon cancer?
Well, the main test, the most efficacious test for detection of colon polyps and colon cancer is the colonoscopy. It's a test that we use with a fiber optic camera that we insert and go all around the colon and look for these little clumps of cells called polyps. And if we find them, we can actually remove them. And in that way, we prevent cancer from forming.
And that's how, I mean, this is a good way then for people to prevent colon cancer. So all the different signs there, you can see it on your screen, really help you prevent any kind of signs of that form.
And the colonoscopy, many people are fearful to have a colonoscopy done. They may have heard many different opinions. But for the most part, colonoscopy is a very safe procedure. Nowadays, we have excellent medications to help you prepare for it. It is not as bad as what we used to have many years ago. And the procedure itself is painless. You're under anesthesia. It's about a 10 to 15-minute procedure. You're unaware of it. And then after the procedure, you wake up and go home.
And that's fantastic. I mean, because it's not the normal uncomfortableness that people are accustomed to with the procedure.
Yes.
Dr. Prazak, thank you so much for coming on the show.
Thank you very much.
And for more information on screenings, treatment, diagnosis, or prevention of colorectal cancer, just go to BaptistHealthSystem.com.